Hello, everyone. My name is Abby Lawson, and I would like to welcome you to my Capstone reflection. When working on a project, it is critical to perform reflection because it helps you to understand the effectiveness of a project. This video reflection will include my analysis of the Capstone project and how constructing the intervention plan has benefited me. Reflective practice is an important part of the nursing profession. It assists healthcare providers in determining how well their efforts worked to improve the health of their patients and what may have been done to better achieve optimum patient health improvement. The following is an examination of the Capstone project and a brief description of how establishing the intervention plan has benefited me. First, I'd like to discuss contribution of intervention to patients, followed by the use of evidence and peer-reviewed literature, how intervention leveraged healthcare technologies, influence of health policy, and then finally, how the project met initial predictions. My intervention was aimed at preventing and treating hypertension in African Americans. My patient suffers from hypertension and is unsure how to treat and control the illness. He found it difficult to manage the condition due to lifestyle change issues. I was sympathetic to his situation and decided to assist him by providing patient information, connecting him with community resources, and demonstrating effective evidence-based practice solutions for lifestyle changes to address the health condition. I obtained my patient's consent to proceed with the intervention. I also informed him of the need to involve his family in the intervention because they would be a source of support for him throughout his treatment plan. I told him that he and his family members would have to submit feedback for me to fine-tune my activities in the future and achieve optimum success. Instead of the previous therapy regimen, the patient felt relieved that the intervention was personalized to his unique needs. His family viewed this as a positive strategy to assist him in managing his health and increasing adherence to medicine and lifestyle changes. Both parties loved that they were included in creating the treatment plan and felt that their opinions and suggestions mattered. The patient particularly felt proactive in his care and gave us numerous suggestions on which activities and diet he preferred, which helped him effectively control hypertension. According to Centillo and Murdoch, developing active engagements with the patients seeking healthcare services regarding hypertension treatment and medication adherence support their hypertension curation. These encounters are the sum of all patient interactions in a healthcare facility, and they impact their perceptions of how care is delivered. The patient provided input on his experience with the intervention and the care he received afterward. He added that he thought his treatment plan was extraordinary because he achieved most of the specified goals for managing his sickness. He also stated that he now considers his access to high-quality care activities to be timelier and more effective. Communication and coordination were aided by team-based care activities, which improved patient satisfaction. This was confirmed by my patient, who was really pleased with his treatment plan and the outcome of the intervention. His improved satisfaction stemmed from taking into account his cultural beliefs and the patient's family's inclusion, which provided support. The patient and his family were especially impressed by the community wellness initiatives and community health care providers' commitment to completing the intervention. Furthermore, patient education greatly aided the patient in improving his health, which added to his pleasure. The patient lacked a clear grasp of their illness and how to manage it properly. To guarantee better patient outcomes, scholarly and up-to-date literature must be consulted when designing care plans. To inform their practice, nurses must undertake good research and access peer-reviewed material from their organization's library or other online sources. I did a lot of research on hypertension and discovered a lot of information on the disease and how to treat it. To establish credibility and authority on the subject, I had to ensure they were published by a professional organization or scholarly peer-reviewed sources. This study relied heavily on the Capella Online Library. The patient care intervention exploited various HTCs, or healthcare technologies, to realize the immense improvement in the patient's health. According to Harvin et al., wearable devices and smartphone apps have been proven to help AA patients access care conveniently. Telehealth solutions were employed to support virtual clinics and appointments to reduce the cost of care and enhance access to high-quality care. Furthermore, e-health was used to ensure that the patient received frequent reminders to ensure the regimen was followed. The intervention was informed by health policy, which ensured that every activity included in the plan complied with policy regulations and governmental and facility expectations. The Centers for Disease Control and Prevention states that public health strategies and plans are needed to manage hypertension among African Americans. The policy guided the intervention, and my patient signed a consent form after learning about the intervention and how his data would be used. It also required us to only share data with authorized individuals and to communicate exclusively through secure platforms. It emphasizes the importance of implementing public health measures to address challenges such as poor healthcare access and drug adherence. The policy's provisions inform my intervention to use telehealth tools to increase access to quality, affordable, and safe patient care. Telemedicine is also required in the facility where I work to manage chronic diseases for patients who are not hospitalized. Furthermore, nursing standards established by the state dictated how the patient was cared for. As the care coordinator in charge of my patient's outcomes, I ensured that best practices were followed and always advocated for my patient. The policy requirements and nursing standards thus inform my action to achieve improved patient outcomes and adherence to nursing practice guidelines. My intervention clarified my role as a BSN-prepared nurse and has the potential to assist me in advocating for better hypertension management in healthcare institutions. Before implementing the project, I had written down some predictions of the outcomes I would notice at the end of the program. Although not all predictions were fulfilled, I was pleased that the most significant ones were, and that the patient cooperated in achieving the desired results. My initial primary prediction was that the intervention would help enhance my patient's outcome, which is why I decided to use it. When he comprehended his therapy regimen and was progressing at the end of the intervention, the prediction came true. He also had better access to high-quality, safe care, which improved his results. After studying how the patient treated the hypertension condition, I projected that the patient's prescription adherence would improve. As the patient's ability to take medicine as prescribed improved, this prediction was mostly realized. Despite working in a high-stress setting with inconsistent shifts, I projected that the patient would improve his exercise. He completed 1 hour of mild exercise every evening after work. When he provided me with his comments on the issue, I predicted that he would have a great experience that would boost his pleasure, which it did. In addition, I anticipated that his family and neighborhood would be quite supportive of his routine. His family assisted him in sticking to the self-management exercises, and community services supplied him with crucial resources to help manage his diagnosis. Some of my forecasts, however, did not come true. I predicted that if the patient fully understood the diagnosis and prognosis, he would adhere to the regimen. He was, however, unable to minimize his intake of processed meat, such as bacon and hot dogs. For me, the RN to BSN program has been both hard and rewarding. I've been under much stress as I've tried to manage school, employment, and my personal life. I have also been able to help my neighbor who had issues with managing her 10-year-old son with type 1 diabetes. I've always been interested in hypertension management for myself and the patient. Hypertension is a disease that is on the rise in the United States and around the world. I knew that focusing on the disease would benefit me professionally by expanding my knowledge and allowing me to come up with new ways to apply evidence-based practices and care solutions to other patients, thereby preventing the disease from spreading and ensuring that the patient population receives exceptional care. I have learned how to best care for such a population and the importance of using available resources in addressing healthcare issues. Excuse me. I have learned the importance of setting goals, discipline, and time consciousness in every undertaking. I've learned that team-based therapy is critical in managing hypertension and other cardiovascular risk factors in African Americans. Working directly with a hypertension patient has given me a better understanding of their situation, making me more sympathetic to their suffering. I've learned how important family bonds are in African American cultures. I've learned how to support successful communication and cooperation and engage in reflective practice, which has assisted me in putting my theoretical knowledge to use. I've also understood how to effectively harness my abilities and strengths, while simultaneously addressing my limitations to provide better patient care. Thank you.